You know that moment when your doctor says, "We may need a C-section." And you smile and nod, but inside, 100 questions just showed up uninvited. I'm Dr. Aditi, and I know that feeling. And honestly, those questions deserves a real answers and not just reassurance. So before you walk into that room again, let me give you something actually useful, a way to understand what you are being told, so you can be part of this decision and not just a passenger in it. Here is the thing. Not all C-section recommendations are the same. They generally fall into 3 situations, and understanding which one you are in, that changes everything. The first situation is a medical emergency. No decision, no delay. If your placenta is completely blocking the birth canal, a condition called as placenta previa, a vaginal birth is physically impossible and dangerous. If your baby's heart rate drops in a way that shows her oxygen supply is compromised, every minute matters. If the umbilical cord slips down before the baby, cord prolapse. Surgery happens in minutes. These situations, the C-section is what keeps you and your baby safe. There is no alternative, and the speed of the decision is itself a protection. The second situation is a clinical judgment call. Labor that has been going for many hours without progress despite all the right intervention. A baby lying sideways or in a position that makes vaginal birth unsafe for her. A mother whose blood pressure is climbing to a level that makes continuing labor risky. Twins where the baby is not head down first. These are real, valid medical reasons, but they involve assessment, timing, and clinical weighing of risk. And these situations, you have a right to understand what specifically your doctor is saying and why the decision is being made now rather than later. The third situation is a planned or elective C-section, a decision made in advance based on your history, your anatomy, and your previous birth experiences, or your own informed choice. This too is a legitimate option. Now, here is the part our medical system often skips. India's private hospital perform C-section at nearly 4 times the rate the WHO considers medically necessary. This does not mean your doctor is wrong. It means the system is under time pressure, litigation fear, and scheduling realities that sometimes shorten the conversation that you deserve to have. So which situation you are in? The best way to find out is to ask. And I know what you're thinking. Is it okay to ask? Will my doctor think I'm being difficult? Let me put that worry to rest. Asking question is not confrontation. It is literally how informed consent works. So here are the 3 questions. Write these down. First, what specific finding or condition is leading to this recommendation? Second, is this an emergency situation or is there time to discuss options? And third, what are the risks of proceeding with C-section and what are the risks of attempting vaginal birth giving my specific situation? A doctor who is confident in the recommendation will welcome them. You grew this baby, and you are allowed to understand how the baby arrived. If you need a second opinion or just want to talk it through with someone, consult a verified obstetrician on Practo. Come with your questions, you have got them now. So share it with the women who need to know this, and if you want to keep up with actionable advice that actually matter, subscribe to this channel and hit the bell icon. And in part 2, we are going inside the operating theatre and what actually happens during a C-section from the anesthesia to the very last stitch and what your body does in the 6 weeks after. See you there.